I had several bad experiences regarding conceiving and keeping the pregnancy. Even if I was really young, I got several biochemical pregnancy and one miscarriage without any specific reason. Basically, nobody really looked at that. The first consultation with Dr. Gleicher was kind of funny because I was an embryologist here, and for a few years I didn't want to think about having a baby. So we were just talking, and I said, well, maybe I should try. And Dr. Gleicher asked me several questions about my previous experience, and then, we went through that. And we did some tests, and we figured out that I had an autoimmune problem. I was suspecting this just even before, but anyway, was not really, sure. So basically we did the test, and everything came out positive. So I had this kind of autoimmune problem. And so we start, a new cycle, the first one actually, and I was treated. And basically everything went really well because I have a beautiful daughter. The IVF process treatment here was kind of easy for me. Well, I didn't feel any kind of pressure. It's really important, I think, for the patient because, I was not like treated as anybody here, like just a number, but just like a person. So, and, the treatment was very nice. Both, actually, the doctor followed me in each single step, and everything went perfectly. And I was treated for my immune system also. And everything went really well. I was very satisfied. It was totally different situation that I experienced before, totally different. My personal experience really is helping me now with the communication with the patient, because I was a patient here and at the same time an embryologist, so I can see the thing from both sides. And every time that I speak to the patient and I see that are kind of negative or like hopeless, I can really, give them some hopes, because I can tell them my story and they are kind of, I can tell that they are happy to talk to me. And even for me, it's very nice to, when I explain about everything, give some suggestion, and it's really, very nice. I'm an embryologist, so I do ICSI, I do everything in the lab, but not only. When I speak to patients and I explain everything, I think it's really important, this kind of communication that I can have with them based on my past experience. So I think that emotionally it's really important for them to have somebody who went through the same kind of treatment, and with success, of course. And they can see, as I said, hopes, and they feel free to talk to me, maybe in a different way, not only like because they are talking to the embryologist, but they are talking to a person like them that went through the same kind of experience. So this is nice. This is actually for me really important, because I have not only, as I said, as an embryologist, the part of the lab, but I have also this kind of support, psychological support that I can give to the patient. Becoming an embryologist is a sort of mission for me, because from my past experience, I want to do this. It became really important for me to help people with this kind of problem. So even if before, started working here, and I studied biology, so I was already interested in this kind of, I would say, field. Then I became more and more interested. And now for me, it's a mission. I want to help other people.